Hello, and thank you for joining me today. My name is Abby Lucius, and I'm the Community Development Manager for Community Clinic of Northwest Arkansas. Today I'll be speaking to you about our initial findings after implementing the Prepare tool. The objective of our research was to explore the relationship between the multitude of predictor factors that are assessed in the Prepare tool and see how those assessments overlay with chronic disease diagnoses seen in our patients during the year 2019. Community Clinic implemented the Prepare tool in late 2018, so it was decided in early 2020 to capture the data collected from the full year of 2019 and overlay with some chronic diseases to see where we got the most results from. And we had collected well over 6,000 responses in the year 2019, and the most standout chronic disease that we saw in our patients was going to be hypertension. We serve a very unique population in Northwest Arkansas, being home to the second largest population of Marshallese and Pacific Islanders outside of those islands themselves. So we weren't surprised when we were faced with some interesting information about common chronic diseases, and then looking at some of the social determinants of health that are measured with the Prepare tool. One thing that we were surprised, though, is trying to understand how some of these modifiable and non-modifiable risk factors can have downstream effects on our patients' health outcomes. We certainly wanted to see how we could understand better the information we are taking in now by the thousands to see how we can better serve our patients. So we collect all of our patient information through our electronic medical records system, and after our new patient paperwork is completed, patients have the option of completing the Prepare survey, and we then look at whichever patients we have completed data from. So anyone who did not fill out all of the questions were excluded. And then we ran a logistic regression between some of those predictor variables and demographic factors to see how that aligned with the chronic disease of hypertension. We also ran with depression and found that it was not quite significant at this time. However, with our results, we did find some interesting things. Patients with a diagnosis of hypertension had a significantly higher odds of socializing less often than 5 times a week, with reporting more significantly likely to have only socialized between 1 and 2 times a week, and also 3 to 5 times. And also, again, not surprisingly, reporting high levels of stress. Additionally, we found when looking at some of the demographic factors that more of our male patients that had completed this survey also were experiencing diagnoses of hypertension. Now, this is a relatively small sample size in comparison to the total number of respondents, especially when we look at the number of patients that Community Clinic serves every year, closer to 40,000. And certainly we can't make any causal inferences. However, some of these associations may provide great insight into how we can better use our wraparound services at the clinic to better serve our patients. So certainly when we're talking about stress and socialization, we can bring in our behavioral health team to better look at ways to lower those numbers, and then looking at our patient advocates to see how they can help address some of those other needs, such as transportation and housing, and then of course share all this information really closely with our medical team who are helping diligently manage chronic diseases. We're looking forward to future years and more data collection to find more associations between the data that we're collecting with the Prepare tool and to better understand how we can serve our patients. Thank you.